But you still feel mild tightness?
Yes.
Yeah, I'll call that full.
Okay.
You have a significant amount of adhesion in your low back and a moderate amount on your right psoas.
The mic is on. Okay. Right now I'm at the Barefoot Rehabilitation Clinic to treat, my hips. Because after giving birth to Paige, my hips haven't been the same. And this clinic specifically deals with pain. It treats pain. It's not like a chiropractor where you go and you get adjusted. This office specifically target pains and try to eliminate it. So when I fall asleep at night, for some odd reason, if I don't keep a pillow in between my legs, my hips go numb. So the whole purpose of today is to see Dr. Chris, see what he can recommend for me and to be treated. And I'll take you through that today. I'm excited to see what this visit is going to be. Pulled up, the office was right there, so it was real easy to find.
Okay.
Parking was really easy to find. We got really lucky. Someone was pulling out just as we was pulling in, and my husband was like, yes.
Yes, I love that. Cool. So you come from a little bit further away from normal. So normally what we do the first visit is we talk about what's been going on. Our patients have had pain at least 6 months, have normally seen at least 3 other doctors or therapists without the permanent relief they want.
Okay.
So it's really important to us that we're not just another doctor on the medical merry-go-round.
Okay.
So as long as this looks like something we can help with a high probability of success, we usually move forward and schedule the exam for after today. But since you're coming from a little bit further today, we're going to do the exam right today.
Okay.
And then we'll come up with a diagnosis, and based on that diagnosis, we'll see about how much permanent relief we can get you with what's going on.
Okay, that sounds awesome.
Cool.
That sounds awesome.
So yeah, tell me what's been going on with your low back and the numbness as well.
Okay. After giving birth to Paige, she wants to play with the phone. You dropped it. After giving After giving birth to Paige, I noticed that when I fall asleep, my hips go numb if I don't keep a pillow in between my legs.
You sleep on your side?
Yes, I sleep on my side. And at first I just thought, well, maybe it was just something after the C-section, because I gave birth via C-section. I thought, well, maybe, it'll go away. But just recently, before I came to this office, I said I have to test out to see if my hips still go numb prior to seeing Dr. Chris, and it still doesn't. My hip still goes numb if I don't keep a pillow in between my legs while I'm sleeping.
Where? Can you point to it? Where it normally would be?
It would normally be, let me see, so if I'm sleeping, more so in this area.
Where you're pointing between your thumb and your index finger.
Yes, more so in between that area. So it's like, I don't really know, it's more so deep. I can't really target exactly where it's at.
Got it.
It's more so deep. So I don't know if it has anything to do with my lower back, because my lower back also is tight. So it could be that, I'm not sure. If I stretch this way, I can kind of feel where the pain would be from here on down.
But it's not numbness or tingling when you do that, it's pain.
No, yes, it's pain.
And how about this side, same?
It's not as tight as this side. This side is worse.
And so let's talk about the low back first. You said it's on both sides of your low back. It's achy and tight.
Yes.
And it gets as bad as 6 out of 10? Or is that the tingling in intensity? Is the numbness or tingling is 6 out of 10?
I would say the pain is, when I stretch here, I would say it's about a 6. And I have to be mindful because I'm very good with pain. I have a high pain tolerance.
Yeah, so you ignore it.
Yeah, exactly. Exactly.
I get it. And how about when you get out of bed in the morning? Is it a little bit stiffer or more painful?
Yes.
For how long?
About as soon as I get up, I wake up, I'll go to like 10 minutes, and then I won't notice the pain anymore. So I would say about 10 minutes.
I love her. Now it's just, we're gonna go forward and move forward with the exam.
Okay.
This sounds like it's a disc issue, irritating some of the nerve roots that are coming out.
Okay.
So, and it sounds like it started a while ago with one or both of those car accidents. And so now it's a matter of, we're gonna grade all of your tests and your ranges of motion. We're gonna see how much of this adhesion stuff you have. It's the most common cause of chronic pain that no other doctors are talking about. We're the only clinic in New Jersey certified to find and fix it. And to the extent that you have a lot of it, we're gonna be able to help you a lot. If you have a little bit, we'll help you a little bit. But whatever amount you have, I'll just be honest with you with your diagnosis, and then we see how far we can take it.
Okay, awesome. That sounds awesome.
So this is the future of chronic musculoskeletal care, and it's the right thing for people to get what they need to get better.
What made you want to actually treat pain, and what makes your office different from a regular chiropractor?
Yeah, so I don't adjust joints at all, like not at all. And we're the only clinic in New Jersey certified to find and fix adhesion. And most people don't even know what it is. Even most doctors don't know what it is. A lot of doctors who do know what it is say they treat it and don't do it well.
Wow.
So we just do it very well. I mean, we have over 150 testimonials on Google, Facebook, YouTube. There are a lot of different variables, but one is we're honest. Like, I don't claim to fix everybody. I can only fix people as much as they have adhesion. And we can know that at the exam, and people like that. So I'm not if I promise somebody, most people pay between $2,000 to $4,000 for our care. So if I say to somebody, like, you're gonna be 100% better, and then we finish the case and they're 50% better, they're gonna be like, Chris, what the fuck? Like, I just paid you $4,000, you said 100% better, and I'm not. And we don't have any negative reviews on Facebook or Google or anything, and I'm really proud of that because that means that we're delivering on our promises.
Yeah, that's awesome. I definitely have to get my mother to come in. Regarding insurance, do you cover insurance or how does that work?
We do cover insurance, but we're out of network.
Okay.
So what that means is that we haven't signed a contract saying that we're going to deliver our care based on how the insurance company thinks that we should do it.
Okay.
Because there are no diagnosis codes for adhesion.
Oh, okay, that makes sense. That makes a lot of sense.
Medicare is like the government healthcare.
Right.
You can only get paid as a chiropractor if you adjust joints.
Wow.
And we don't do that.
Okay.
And if that were working, people wouldn't be coming into this office.
Exactly.
We are learning as doctors where we are seeking to revolutionize pain care by understanding it's no individual doctor's fault, but it's this paradigm of let's just do random physical therapy on you, and let's do massage and randomly chiropractic adjust you. It's not helping people. Okay. They're wasting money, they're wasting time, they're wasting energy, and then their joints get worse as time goes by. Their pain gets worse because they're not addressing the problems. It's no artificial band-aids. It's where's the wound, and how do we fix the wound and heal it.
Yeah.
Let's go do the exam.
Okay.
And we'll just migrate into the other room.
Okay.
Paige can walk us over there.
Yeah, she's busy. She's being curious.
Yeah.
I was gonna say like, yes, a break.
She's like, no.
On my back. Just a little tension.
Where did that tightness increase?
Yes.
In the hamstring? Okay. Increase with dorsiflexion.
Got it. What do you feel? Tightness?
Yeah, it's
Where?
mostly my hamstrings. I'm not sure if it's my calves and hamstrings, but I feel it.
4 3/4 flat.
Mm-hmm.
So you're gonna keep your chest straight and upright, and then you're gonna go ahead and go as forward as hard as you can.
What do you feel?
Moderate pain, no, not moderate. I would say slight pain, like around my hip area right here.
Is this common when you do lunges? Do you ever do lunges?
You know, I do lunges often, but now that I'm paying attention to the area where I feel tightness,
Right.
that I'm conscious of it.
Right. Got it.
Yeah, I think I ignore it often, but.
Sure. That makes sense. Mike, significant adhesion, right L4S1, multifidus and longissimus. Same on the left side. Good. Done with that. Come on up, Magda. So Magda, come and slide all the way back towards me so that my thigh is supporting your low back. So your psoas muscles, your filet mignon is in the front of your spine and your belly.
Okay.
So that when you do that stretch, and also when you do that lunge stretch,
Right.
it's like this muscle. So I want to check it.
Okay.
So is it okay if I lift your shirt and I work on your belly?
Yeah.
Okay. Cool. You can relax your leg. Mike's gonna move your leg for you. You don't have to do anything. Okay. Go ahead, Mike. Breathe. Mild to moderate. Okay. Come on up, Magda. So had that accident at 12, accident in college, a little bit of tightness and pain before you had Paige
Yeah.
9 months ago, and then it got a little bit worse since then,
Yeah.
and also have that tingling when you don't have the pillow between your knees. So we have a few different findings, and all of these pieces are a big deal. One is, like you mentioned already in the history, we know that you have some level of disc degeneration with nerve root involvement from your spinal cord. Anytime you have tingling, it indicates that a nerve is being compromised. So it doesn't mean that anything is really huge is going to happen with those nerves, but ideally, we don't have things that make the nerves get pissed off. That's what tingling is.
Okay.
So we know that's a part of it, and that's okay. This part isn't permanently fixable because it's a form of aging, but we can slow it down so that you have more longevity over the next 10, 20, 30, 40, 50 years, and so that you age more gracefully.
Okay.
So that's that part. Two, you have a significant amount of adhesion in your low back and a moderate amount on your right psoas. The good news about you having this problem is we're the only clinic in New Jersey certified to find and fix it. So you're in the right place. And number three, you have a little bit of relative weakness, and we'll talk about how that correlates to your pain as well. So first, this part, the disc degeneration. A normal disc is like a jelly donut. You have some form of bulging, the jelly coming out of the donut, something where it's outside of the normal circumference of it because it's affecting where the nerves, this is the spinal cord, or the spinal column, and this is where the spinal cord is. And so this is pushing on one or both of those nerves on both sides.
Okay. That makes sense.
And so that's okay. We can take stress off of that disc by getting rid of the adhesion. That's what we're gonna do.
Oh wow. It's interesting to hear you say this because, as you mentioned before, I've been to different chiropractors and I've never heard anyone speaking about getting rid of the adhesions, and wow.
Every single patient who comes through our doors has had pain at least 6 months, has seen at least 3 of their doctors or therapists without permanent relief, and almost all of them have never heard about adhesion. And we've hired 3 doctors in 2019 alone, so we are growing rapidly, and it's just because chronic pain's not going away. More and more people are getting hurt and struggling with it, and so having really good pain care is important because we don't want each other to suffer. So yeah, this stuff is a huge deal. So what is adhesion? Your muscle is a piece of steak. It's supposed to be flexible, it's supposed to be strong. Adhesion is like glue inside of it. It causes your muscles to be tight. It causes your muscles to be weak. Your low back range of motion is 60% of what it should be. And Flexion is the most important range of motion because the muscles that primarily are involved with the low back limit flexion.
Yeah.
So they could be correlated with you having restricted rotation as well.
Right.
But it's that information is not as helpful as going straight after flexion in that quadruped all four position.
Okay.
So the way I was taught by my mentor, we don't do unnecessary testing. We only do as much testing as we need to gather information.
Okay.
Does that make sense?
Yes.
So I'm gonna pull up the good test. This is when we used to use the pencil ruler. So this person has 90%.
Okay.
You can see that they're flat from 0 to 1.5 inches.
All right.
And then they round the rest of the way like a hill. You're doing that cat-cow stretch, so it should be rounded like a hill. You're flexing the spine.
Right. Okay.
Make sense?
Yes.
Okay, let's show you. Notice there's a little bit of shadow
Right.
from 1/4 inch to 1 1/4.
Uh-huh.
You're flat from 1 1/4 to 4 1/4. Then you see the shadow again
Right.
there.
Okay.
So you're stuck in extension right here. So I imagine, I don't know, we didn't talk about this, but if you do any exercises where you have to flex and round, I don't know if you do deadlifts or you do back squats where your butt's coming all the way down.
Yes.
Because you don't have access to that range of motion, it probably causes some increased stiffness, tightness, or pain.
You know what?
Or you're not paying attention.
It's been so long since I've done a deadlift.
Okay,
like,
okay.
Exactly. Like maybe I don't pay attention to it. I just
That's
go
okay.
in and I just lift. But that's quite interesting.
Yes.
Yeah.
So this is an objective measurement for your low back. You don't have any ability at L5S1 to flex. And this is the most common disc that gets degenerated. So if we got your MRI, it's probably going to be L5S1.
Oh.
So now we know, and this is also where I felt the most adhesion from L4 to S1.
Wow.
So that it's all making sense to us.
Okay.
So in order to get your discs to age well, and so that this doesn't become an increasing issue 5 years down the road, 10 years down the road, we need to get that range of motion back and get rid of that adhesion. So
this stuff here. All right. We're all set, right?
yeah, we're all set.
Thank you so much. I'm excited to see what's to come. I'm really excited. Thank you. Thank you. All right. And Ralph is out front, right?
Yeah, he should be.
Okay, Doc. Take care. Thank you. Bye, Mike. Nice meeting you. Bye-bye, ladies.
Bye. Bye.
Oh, she has a friend. Yeah, we were in the dot. Oh. Say hi, boo.
She's not even crying.
No, look at her. What's she
Right
eating?
past you.
I know. Who will care about me?
Oh, hey.
Oh, this is so cute. Oh my gosh. Thank you.
really is, yeah.
Thank